ID cards can be confusing because you might have an independent TPA, you might see an employer logo, you could see a PPO network logo. If you're not in the industry, there's a really good chance that you're going to be really confused.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefit systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
Today, we're going to talk to Todd. This year, he is celebrating 20 years in the insurance and benefits industry. Todd is a member of the Self-Insurance Institute of America and Society of Professional Benefit Administrators. Talking about benefit plans, what they look like, and how they work sounds like a boring business, but thankfully, it's never boring when you talk to Todd. As our Chief Sales Officer, Todd leads our sales team, so it's great that people enjoy talking to him. Before the podcast, we asked Todd what he most enjoys about working in the industry, and he said bringing solutions to help improve the outcomes of our membership. When I think about what that means for members, it means that our nurses are working with providers, members, and their caregivers to help them navigate their condition in the healthcare system. And healthier employees and families should translate to lower costs for members, the benefit plan, and their employer.
Thank you for having me. It's a pleasure to be here.
Thank you for doing this twice. We're glad to have you back.
He came back.
So we invited you to talk to us today about medical networks specifically. I think members and sometimes the provider's office can confuse the logo on an ID card with the medical network that the plan might be using. So I think it used to be the case, at least I remember when I sort of glanced at my old ID card before I started working here, the logos were one and the same.
Yep.
I think increasingly it is common that they are not the same and there are multiple logos all over an ID card.
I would agree with you 100%. ID cards can be confusing because you might have an independent TPA that you're familiar with. You might think that you have Nova insurance, but Nova might not be the network. And so when you look at the ID card, you might see an employer logo. You could see a Nova logo. You could see a PPO network logo, and even make it worse, there's probably a PBM logo on there. So if you're not working in the industry, there's a really good chance that you're going to be really confused. And oftentimes, if you take a moment, especially at the provider's office, if the provider would flip over the ID card or read the ID card, they would understand the relationships of all of the logos that are on the ID card. But unfortunately, oftentimes, which we have seen with maybe some of the national network partners that we've worked with, is that somebody in the provider's office might see a Buca network logo on there, and they'll call whoever that health plan is when they're not really the health plan, they're just the network. And that health plan will say, no, that person's not enrolled here. And now all of a sudden the person's having issues at the point of service, which is scary. So that's why it's really, always important to educate the membership so they can tell the provider to flip over the ID card. And that's how you're going to verify my benefits and eligibility. But healthcare is a very confusing space, right? So if we can just educate the members to say, hey, when you're having these issues, just call Nova, the number on the ID card. We can typically help them navigate that current situation so that they can get into the appropriate place at the appropriate time.
Yeah, it's like welcome to Logo Land.
Yeah.
It's a fun adult game.
Right. And sometimes you might have two logos on there, right? So there's national network solutions. There's regional network solutions. Typically, if you have a national network, you're just going to have one network logo on your ID card, and you're going to be able to access care no matter where you are in the country. Oftentimes, employers are also using regional networks, right? So I think of my own health plan. So my own health plan really covers me and my backyard, the 8 counties of Western New York. And in reality, I don't really ever go and seek care, right? So my primary care specialist, I live in Buffalo. I'm not going to go get a primary care specialist in Pittsburgh. So my regional network here is perfectly fine. But, if my family and we decide to go travel somewhere, go on vacation, probably won't happen for a really, really long time due to my current arrangement of children. But anyways, if we are out of the area and we do need to seek care because maybe I'm not feeling well or one of my children has a temperature, we want to be able to seek in-network care. right? And my regional network here in Buffalo, New York, isn't going to provide me access to in-network care in Florida. So in my instance, I actually have two network logos on my D card. There's my primary, my regional network here, where I seek 99% of my care. But then there's always the what ifs if I'm outside of the area and I need to seek in-network care. So a lot of regional networks will also have a wrap network. Some people refer to them as a travel network. You can't leverage these wrap networks to have a primary care physician in Pittsburgh, but it is an opportunity for you to seek in-network care in the event you need to seek care and you're outside of the area. And more often than not, the way that care would be covered in network is you typically have to call your health plan and say, hey, I'm in Florida, my kid's at 104 temp. Can I go to the wrap network and receive care at the in-network benefit level? So that's usually how regional networks work. There's regional networks all across the country. There are BUCA networks that lease out to independent TPAs. A couple of them started doing it probably like 14 years ago, 12 years ago. And at that time, a lot of the employers across the country wanted their employees to have access to deep discounts, and I'm using air quotes, as well as care anywhere they want. And so a lot of the people have transitioned at that time away from the regional networks where they wanted to have access to everywhere. And I've kind of seen healthcare do a 180 since then, where a lot of people are now moving away from those national networks and they're going back to the more regional networks for a handful of reasons. And one is a little bit more control. A lot of the national BUCA networks, they have requirements for plan design, the ability to steer within the walls of that network, direct contracting. So more and more employers are really more concerned now about just having access for their employees and their dependents to high quality care at the right time and at the right place. And they want it to be cost effective versus just providing open gates, allowing them to go anywhere for in-network care. So a lot of providers or employers are kind of going back to the old school way where they have more flexibility, where maybe they can do a direct contract with a specialist or a hospital in their backyard and get maybe some more aggressive pricing for what they're going to pay for the claims. And what they do to steer the membership there is they might make it a copay to steer utilization and incentivize people to use those providers. So the nice thing about what we do as an independent TPA is each employer is trying to do something a little bit different, and we can kind of bring the flexibility to meet them wherever they are in the road of making that decision of what they're trying to accomplish. It's not like we're a health plan and this is it, take it or leave it. It's what are you trying to accomplish? And hopefully, knock on wood, we can accommodate it.
Jolene, I'm going to spell out BUCA real quick, because when you think about national networks on a member level, they're looking at like a Blue Cross Blue Shield, an Aetna, Humana, United Healthcare. So they might have that logo on their ID card, but it might be one of many logos that are on the ID card. So to your point, when you show up to a provider's office, they're just looking at a logo. They see the one that they recognize, which is a national network, assume that it's necessarily through Blue Cross, United, Aetna, Humana, and it's not. It's a leased network through another organization that the member has access to, but that's not the place you're going to call or send claims or process things. So on the member side, then that becomes a nightmare because they do have access. It's just a different kind of access to that same network. And then their claims get all screwed up and the pricing is different, and it can lead to a less than ideal experience for the member from a billing side. But once they look at the ID card and they understand why all those logos are there, then I feel like you can sort of advocate for yourself a little bit more.
Yeah, I mean, honestly, so we saw with January 1st being the busiest time of year, like we actually just experienced a lot of that. We hear it maybe through brokers or the employers that my employee went to the doctor and they say that they're not eligible. And then we look into our system and say, yes, they are eligible. They're in there. But somebody might go in with a Nova ID card. There's a BUCA logo on it. That provider is seeing that new ID card for the first time. They see the BUCA network and then they just kind of go on cruise control to what they would do with those normal Bucla health plan members. And then typically, it's just a short learning curve. Once the provider is explained how it works once, it's fine moving forward, but you'll oftentimes see an uptick. If you're bringing on larger populations at a certain time of the year, you'll see more of those issues until the providers are educated.
Mm-hmm. Yeah, I think it just requires education all the way around at the provider's office, the member kind of understanding what's on their ID card. And none of this is stuff that you want to spend your free time learning. But I do feel like it saves you so much time in the long run from having to be on the phone with customer service trying to figure out why something didn't pay the right way, or why it looks like you were out of network when you were in network, or you're not a member of that plan because they were looking you up in one system and really they needed to be looking you up someplace else. So it's not fun, but it's super helpful in your everyday life.
Right. Agreed.
Thank you for using examples, because I think we throw the terms around like everybody knows, what the hell we're talking about. But in reality, that's not the case at a member level when you do not work in this industry. So thank you for sharing examples along with some of the acronyms and the terminology.
Absolutely. No problem.
Thank you very much. We appreciate you joining us. Always learn a lot.
Thanks for having me. I look forward to maybe having an opportunity to come a third time for the hat trick.
I think we can make that happen.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR, the coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.